Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hi, Nita Valens. How are you today?
I'm great. And yourself?
I'm always living it up. How about you? Aren't you always living it up?
Always living it up. Always. That's why we're here, so we can help our listeners live it up and be pain-free. How about that?
I think that's a great idea. And how do we plan on doing that? We're going to explain something about a type of medicine that's called regenerative medicine. And I wrote a book about it. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. So the old paradigm of medicine is to cut tissue out often, even though sometimes like a meniscal tear in the knee could be stitched back. When I see photos of the arthroscopic surgery, I have one right here in front of me on the computer that someone sent that we'll get into a while. The knee became immediately arthritic after the surgery. So it's something we have to be careful of. I've been told by my buddies who are orthopods that if they don't do the surgery, the patient will get arthritis in their knee or their shoulder, their hip, whatever it is. But in my experience, after the surgery, that's when a person really gets the arthritis. And what I'd like to do today is get started with a bunch of callers to make the show interesting. I've got 1 million questions sitting here.
Yay.
From the website, which is, you can write this down, it's www.lastemcells.com. I'm going to repeat it for you while you grab your pen. www.lastemcells.com. Every page on my website has a spot where you can email me personally. I return everyone's email every day, and I get tons and tons of them from all over the world. And actually, there's videos of me doing the procedure, so you can see if this is something you may want to do. The procedures I do are called PRP, which is platelet-rich plasma, and the other one is bone marrow, which is a procedure where we take bone marrow from the back of the pelvis, and that has PRP, and it also has stem cells in it. Stem cells is the hot term today, and we find that the healings are a little quicker, a little more complete by using bone marrow than just platelets. The platelets, by the way, the PRP procedure, we get by just drawing blood from the arm. Very, very simple. They're both simple. They both take about the same time to do. Getting bone marrow for me takes about 15 seconds after we numb up the area.
Wow.
I've done mega thousands of both of them, and I'm probably the busiest guy in the country. That's what I've been told. I'm not sure if that's true, but I do quite a bit of these every single day. I do the whole body. I'm going to give out the phone number to call me right now to talk to me live. I would love to talk to you. The phone number is 866-870-5752. I'm going to repeat it again for you guys. It's 866-870-5752. And if you call me during this hour, I'm going to give you a free copy of my book, $25 value. And it's a free copy of a book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got 256 studies about how regenerative medicine really is a better deal for you than getting a surgery, which can really cause problems. I always tell people, if you're going to do anything in medicine, do the most conservative thing that you can do. And surgery, believe me, is not conservative. I've seen some very simple little surgeries that have cost people lots and lots of problems. Whereas my procedures of doing regenerative medicine are very simple. You walk in, it's a few injections, and you walk out. You don't need someone to drive you. It's real simple. Surgery is a big deal. Stay away from it. It's a last resort, but the last resort is try regenerative medicine first if it's musculoskeletal. Now, if you've got cancer or something like that and you need a surgery, go do that. Cut it out. This is not what I'm talking about. I'm talking about neck pain, back pain, arthritis, shoulders, elbows, wrist, fingers, hips, knees, muscle tears, things of that, ankle pain, plantar fasciitis, things that, all these syndromes that people have, meniscal tears, rotator cuff tears, labral tears. In my experience, I can't promise anyone anything, but we can often get people better without a surgery. Again, the phone number to call me right now is 866-870-5752. And Nita, you have anything to do before I take a call?
Yeah, I just want to
before I answer a question?
I do. I want to just remind people that when you call that number today, you do get the free book, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And it has actually 264 scientific studies, I counted. And the foreword is written by Suzanne Summers. And in her latest book, she has something on you in there.
Yeah, she has a book called A New Way to Age. And I'm showing it to the camera right now. And let's see, it's a chapter about me and my work on page 302. And that goes, I think it's about a 19-page chapter. No, it goes to 316. There we go. So it's about a 14-page chapter about regenerative medicine and how it can heal and how surgery is really the very last resort. Suzanne Summers, we love you very much. You've helped so many people over all the years of your career, saving themselves from drugs, chemotherapy, and surgery. And I follow in your footsteps. I've always been of that nature to do natural medicine. After my residency at UCLA, it was a 4-year residency after medical school, I did another program called a fellowship on natural medicine called Regenerative and Functional Medicine. So it's something that doctors need to keep learning. You don't give up after medical school or residency. You got to keep learning and learning how to do things in a way that is natural and is non-invasive. Do things the easy way. So, may I take a question, Nita?
Well, I was thinking you could, or we could talk to Tom in Chino Hills.
That's what I mean. Tom, it's Dr. Marc Darrow. I understand that your shoulders and your feet are bothering you?
I've been having shoulder problems over the years, and it's been getting increasingly worse to where it went from my left to my right. Just a lot of arthritis. I've had x-rays, and they say there's degeneration. And also, in the neck, had a little setback with when I was doing some work, and now I have some pain in my neck. But I also have, starting about 3 years ago, slow-growing neuropathy in my feet, and I've had genetic testing done. We have a condition called Charcot-Marie tooth in my family, but according to genetic testing, they haven't been able to find anything there. But it's getting increasingly worse to where, my feet are numb most of the day, and especially at night. So I don't know if all those things are related, but anyway, the thing that's most concerned is the neuropathy. I don't know if this can help, that kind of thing.
It might be able to help, but it's not something that I do in my practice. That would be done probably by IV therapy, intravenous, and I don't do that. The medical board and the FDA do not like IV stem cells. There are doctors that do it in this country, and especially out of the country do that. But let me just go on. I don't have
shoulders that.
Go ahead. I'm listening. No, I'm listening.
Yeah. Could you address the shoulder issue with the what actually would be involved in your treatment for the shoulders, especially because it's getting worse. I can't sleep on either shoulder. I sometimes have difficulty raising my shoulder. It's not what's the common one? Rotator cuff. It's just arthritis.
Okay, may I take over for a minute?
Yes, sir.
Okay. Let me finish up on your neuropathy. The first thing you need to do is get a very complete blood test, and we do it in the office. It's called SpectraCell. It checks for vitamins, minerals, amino acids, antioxidants, and you may just have a deficiency that is causing your neuropathy. It has nothing to do with Charcot-Marie tooth, which may be in your family. So that's number one. You do it the easy way. Number two, are you overweight?
No, I'm average weight.
Okay. Number three, have you ever been excessive with alcohol?
No.
Have you ever worked around chemicals?
Only paint. I painted houses for 5 years when I was young.
Okay.
And then,
so anyway, there's things that need to be done. You should see a neurologist that knows the things I'm talking about. And now I'm going to move on to your shoulders. Arthritis in the shoulders is, I'm going to call it normal. How old are you?
I just turned 70.
Okay. So having arthritis in your shoulder after being a painter is normal. It's not something we like, but people end up getting arthritis as an overuse type of a syndrome anywhere in their body, no matter what joint they're working on. And yes, the stem cells, bone marrow, platelets can probably help you heal that up. Did you have an MRI by any chance on your shoulders?
No, I just had x-rays.
Okay. The x-rays aren't going to show you very much at all because the x-rays show the bones. They don't show the soft tissue, the rotator cuff, the labrum, or things like that. It can also, a lot of it can be seen with an ultrasound, which I use. We look inside the body. So that's something, if you want to come in, we can take a look at. And that's high probability we can help you feel better with that. The neck, same kind of issue. We can probably help you with that. And then what are the questions you have about that?
Yeah, just the last thing that you recommended. Could you repeat that?
I'm not sure which is the last thing.
Hello? Hello, doctor?
I'm with you. Yeah, I don't know what the last thing is. You're talking about getting an MRI for your shoulders or using an ultrasound to look inside?
Ultrasound, okay. So
Yeah, it's not the kind of ultrasound that heats up the body that physical therapists use. It's an ultrasound that doctors look inside the body with. Anyway, we got to move on. We've got Israel and Joe waiting here. And God bless you, Tom. There's, I think, very good help for all your issues. If you want to come into the office, the phone number there is 800-300-9300. I'll repeat it. It's 800-300-9300. And if anybody wants to talk to me right now live, I would love to get your call. It's 866-870-5752. Call me at the studio at 866-870-5752. Israel, can we talk to you now? It's Dr. Marc Darrow, and I understand your left thumb is bothering you. How long has that been going on?
Yeah, good morning. I'm seeing a rheumatologist for a while for a few issues. At the same time, this left thumb, not like the right thumb, not like the left one that is straight. This is a little bent to the left. The right thumb is left bented. And I was told that not much you can do unless you do a surgery, and then they will stick some metal in there, and you'll never be able to bend a little bit, which you don't much do as of now. But at the same time, she did not recommend to do that. So I'm with the left thumb kind of crooked, bent.
Yeah.
And sometimes there's a lot of pain from that joint.
Okay. What caused that? Do you know? Is it just arthritis, or did you have a trauma, or what?
No, she says I have arthritis. Like arthritis is like that, and not much we can do. So I take all kind of some medicine.
Sure.
They found
Okay.
out a couple of years ago that I had pseudo gout particles, and then I take allopurinol and colchicine, and
Okay.
not much we can do with that, she said.
Well, I have a suggestion for you. Number one, in order to keep that thumb from deviating further, it would be a great idea for you to do stem cells or platelets in it to stabilize it. I haven't seen it, so I don't know the degree of deviation it has, but you don't want it to get worse, okay? And what's going on is either the cartilage is worn down, which it may be, but the ligaments are probably loosened up that hold it in place. So if that were my thumb, I'd be injecting it with regenerative medicine cells from your body, i.e. platelets and or stem cells. Probably I would go right to stem cells with that because your thumb is so important to your life that you don't want to use the lesser treatment. You want to use them both together, the platelets and the stem cells. Okay, so there's some hope for helping you to some degree. I don't know without seeing it and examining it what I can do for you other than just stabilize it. Okay, Israel?
Okay.
All right, God bless you, man. We're going to go on to Joe. Joe, stick with me a second. I'm going to give out the phone number so we can get a bunch of callers in here. This is Dr. Marc Darrow. I do regenerative medicine, stem cells, and platelets. And the phone number to talk to me live right now, please call me, 866-870-5752. I'm going to repeat it, 866-870-5752. You can give me a fake name if you're shy, or you can just call the office also. I'll give that phone number. It's 800-300-9300. So, Joe, you have a shoulder problem. So today's shoulder day. Yeah.
Good
Joe,
morning.
how long has your shoulder bothered you for?
You know what? It's been about a month.
Okay.
Let me start at the very beginning. I started out with a knee problem, and so I went to an orthopedic. My regular doctor referred me, and so he started me on physical therapy, and my knee started getting better. And so, but I believe that when my knee was swollen and bothering me, I would get up out of a chair or a couch, and I would use my shoulders instead of trying to put any pressure on my knee, and somehow, I don't know, I got like a tendonitis or something in my shoulder.
Sure, that sounds normal, right?
And at first it was my right shoulder, and then my therapy's been going okay, but probably 2 days ago my left shoulder started bothering me, and so I have an appointment in a week with the orthopedic guy. All he's taken was X-rays. He has not taken an MRI, but he alluded to the fact the last time I talked to him about my shoulder that you may want to have a cortisone shot, and I just didn't really say anything to him, but that's where he's kind of going with it. Okay. And so that's where I'm at. I'm waiting to get all the paperwork from him so I can make an appointment with you to go see you and see what you think.
You don't need any paperwork to come see me. Just call the office, 800-300-9300. I'll repeat it for you. It's 800-300-9300. I don't need a doctor's referral. You just come in.
Oh, no, I didn't mean the referral, but as far as the paperwork, as far as the
I don't need
X-ray
paperwork
or anything like that.
Yeah, I don't need any of that stuff.
Okay.
I do my own examination, and I'll be honest with you, Joe. Most of the time when I get referrals from other doctors, I don't find that their diagnosis is accurate. Most of them don't even touch a person's body. They'll do a film, MRI, or X-ray and tell you what's going on, and then tell you need a cortisone shot, which is a steroid that breaks down the tissue, which I don't like at all. So it's not that I don't like other doctors. I love doctors. They're hard-working guys. But traditional medicine is something that we obviously all learn. You know, med school is 4 years. My residency was another 4 years. And then I did another fellowship after that for a couple of years. So we're all trained pretty good, but I don't like the traditional form of medicine. I'm sorry, I just don't. Don't hate me for that, please. I like to go beyond that. We all know it. But there's more things that can help people than we learn in medical school. And unfortunately, most doctors don't go farther than their training. And they're afraid to do these natural medicine things because they're afraid they won't get referrals from other doctors. So most doctors get their referrals from other doctors. I don't get a lot of referrals from other doctors. Okay, my referrals come from patients. They get better and then they refer their friends.
Because I do know that this orthopedic guy, I found out he's fairly new. They do surgeries, but at the same time he says he does PRP, but when I kind of pressed him on it, he goes, well, I do them maybe once, maybe twice a week, and he's only been at this practice for maybe a year, so I thought I kind of really got a
so
little
let me explain this. Let me explain this to everybody listening, because this is a really, really important point. You don't go to a surgeon to get PRP or stem cells. Number one, they don't believe in it. Number two, they don't do very much of it. Number three, if they say they're doing it, it's a way to get you in to do a surgery. Okay? I'm sorry, that's just what I have seen over and over and over and over. It's not a statement against the surgeons. I love surgeons. Their work is exquisite. Most doctors want to be surgeons at some point, but they don't end up doing it because it's hard. It's really hard work, and the residency is really hard, so they don't end up doing it. But you don't go to a surgeon to get PRP. I have a lot of orthopedic surgeon buddies, and I talk to them about it. They go, well, yeah, I do some of it. I do a little stem cells, but it doesn't really work. So they'll do it once on a patient. They don't even know what they're doing. And then it doesn't work, and then they say, now you need surgery. It's like you're not going to come to Marc Darrow, that's me, to get a surgery. It's not what I'm doing. Could I do it? Well, I was trained in it to some degree, but it's not what I do.
Okay.
And cortisone shots, if you've ever listened to my show before, I'm not for that.
No, I knew that he alluded to, he told me that, and I told him that I didn't really want to do that. And he goes, well, quality of life, and then he went down that path, and I said, okay, well, we'll talk the next appointment.
Well, let me tell you about my quality of life. When I was a young man, as a lawyer, I played a lot of tennis, and I had lateral epicondylitis. So I went to an orthopedic surgeon. I didn't know a thing about medicine. And I had a steroid shot, cortisone, like your doctor wants to give you. It felt so great. The pain was instantly gone. I went back and I played tennis, and it got worse than it was before. Gave me another cortisone shot. What do you think happened? Felt great. Went back and played tennis. And then it got really terrible. Okay? I had to go back when I became a doctor and learned about regenerative medicine. I had to inject my own elbow to get it better. I used regenerative medicine. I have never had elbow pain since.
Wow.
Steroids are just not the way to go. It's a Band-Aid.
Okay.
I know it feels great, but it destroys the tissue. Look it up on Google. Look up cortisone, side effects. I'm not making this stuff up.
Well, I've listened to your show a few times, and I've heard you say that
great.
a few times. I thought, I'm not going to go down that path, but I just wanted to check in with you just to see, because all I have is I have asked for my x-rays and whatever paperwork he may have, and then I was going to gather that and then hopefully see you. So.
Yeah, well, I don't need the paperwork and I don't need the x-ray. There's nothing in an x-ray that's going to tell me anything about you.
Okay.
You know what my x-ray is and my MRI is? My fingers.
Okay.
Okay.
Joe, God bless you, man. Thanks for the call. We got another Joe coming up after the break.
We do. And you're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Anita Valens. Grab a pen or a pencil, write down this important information coming your way, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.